Are you wondering whether tirzepatide and metformin can be taken together and whether that combination actually makes sense for weight management and blood sugar control? It's a question that comes up a lot, especially for adults managing both type 2 diabetes and obesity. So let's break down what the research actually says. First, some important context. This combination is most relevant for adults who have both type 2 diabetes and obesity. It's not a general weight loss solution for everyone. And as always, nothing in this video is medical advice. Please speak with your healthcare professional before starting, stopping, or changing any medication. So how do these two medications actually work? Tirzepatide is a dual GIP and GLP-1 receptor agonist, FDA approved under the brand names Mounjaro for type 2 diabetes and Zepbound for chronic weight management. It works by stimulating insulin release, suppressing glucagon, slowing gastric emptying, and reducing appetite through pathways in the brain, making it particularly effective for both blood sugar control and weight reduction. Metformin works differently. It's one of the most established first-line medications for type 2 diabetes, and its primary job is to reduce glucose production in the liver and improve insulin sensitivity. It's worth noting that metformin is not FDA approved specifically for weight loss, but research does suggest it can contribute to modest weight reduction, possibly through effects on appetite, gut microbiome composition, and cellular energy metabolism. When you use both together, you're targeting weight and blood sugar through distinct but complementary mechanisms. That's what makes this pairing particularly valuable for people managing both conditions. What does the clinical evidence show? Data from the SURPASS clinical trial program found that patients taking tirzepatide alongside metformin achieved meaningful reductions in body weight over 40 weeks, along with significant improvements in HbA1c, a key marker of long-term blood sugar control. No concerning safety signals emerged from the combination. Now let's talk about safety and side effects. The most common concern with both medications is gastrointestinal, things like nausea and diarrhea. When taking both together, those side effects may be additive, meaning you could experience them more intensely or more frequently. The good news is that these symptoms typically improve over time, especially when doses are introduced gradually under your doctor's guidance. One important nuance, the risk of low blood sugar is generally low with tirzepatide and metformin alone. But that risk can increase if you're also using insulin or certain other diabetes medications like sulfonylureas. Make sure your doctor knows everything you're taking. There are also contraindications to be aware of. Metformin is not appropriate for people with severe kidney impairment. Tirzepatide carries a warning for people with a personal or family history of medullary thyroid carcinoma. Your doctor will also assess your history of pancreatitis and overall gastrointestinal tolerance before starting tirzepatide. Renal function should be monitored before and during metformin therapy. Your healthcare team will guide you through what that looks like. So, who is this combination most appropriate for? Research suggests it's best suited for adults with type 2 diabetes and obesity who haven't achieved their treatment goals on metformin alone. It's not a one-size-fits-all approach. Your doctor will consider your full medical history, current medications, kidney function, and individual risk factors. If you're currently on metformin and wondering whether tirzepatide might be a helpful addition, that's absolutely worth bringing up at your next appointment. And if you experience severe or persistent nausea, vomiting, diarrhea, unusual abdominal pain, signs of low blood sugar, or any symptoms that feel new or concerning, don't wait. Contact your healthcare professional sooner rather than later. Let's recap. Tirzepatide and metformin work through different mechanisms, and research suggests they can complement each other for both weight management and blood sugar control in adults with type 2 diabetes and obesity. GI side effects are the most common concern and may be more pronounced together, but often improve with gradual dose titration. Always work closely with your healthcare professional and only use medications exactly as prescribed. If you found this helpful, drop a comment below and let us know what topics you'd like us to cover next. And if you haven't already, like this video and subscribe so you don't miss what's coming up.